Good morning, everybody. My name is Dr. Tahrim Farrukh, and today I will present my multi strategy intervention to decrease physical inactivity in high school students. I have named this intervention the Get Fit program. Physical inactivity is a significant factor leading to chronic diseases in Australian population. Although acknowledged that the physical activity benefits both the prevention and the management of chronic diseases, it is unfortunate that the Australian Health Tracker has shown limited progress while recording the trend of physical inactivity. Therefore, the recommendation is to execute a multi strategy physical activity intervention called the Get Fit program. This will be done in the high schools across Western Australia. This program will aim to implement a mandatory sports hour during school time. The target group is young adults between 12 to 17 years of age. The goals will be to increase physical activity during school hours, develop healthy behavior and practices, and eventually decrease the burden of chronic diseases like obesity, hypertension, cardiovascular, and musculoskeletal conditions. This study will also help to establish relevant policies that could be implemented in an extensively run statewide program and later develop standard health policies, eventually decreasing the burden of chronic diseases. Thus, my intervention clearly states its short term, mid term, and long term outcomes. Now, why is it important? There have been several research over the years that has emphasized the importance of physical activity, and they prove that physical activity in youth is not up to par in Australia. According to the Australian Health Tracker 2021, limited progress was recorded in the trend of physical inactivity between 2011 to 2018. Among the different age groups, young adults attending high schools show a rate of 91.5% of physical inactivity. Results from the Australian 2022 report card on physical activity for children and young people showed similar trends and have given physical activity a D minus, concluding that PA levels remain consistently low. A study by Gallo in 2021 showed that a persistent inactive lifestyle since youth is associated with high chances of developing cardiovascular diseases. Another study showed that physical inactivity, along with alcohol consumption and skipping breakfast, was associated with being overweight and developing obesity. There is much evidence that supports the need of such a program, and therefore I feel deeply passionate about it. It is a widespread practice that public health workers use a health promotion model or a theory as an underlying foundation. This enables them to comprehensively plan their intervention, understand the dynamics from different perspectives, and lay an effective design and implementation plan. Two models that I would want to compare here are the socio-ecological model and the trans-theoretical model. Both models are extensively used for projects and are very effective. About the trans-theoretical model, this model supports that behavioral change is dynamic and it cannot be treated as an all or nothing process. It is very individual based and its five stages tailor the desired change in steps catering to individual needs and motivations. The steps are pre-contemplation, contemplation, preparation, action, and maintenance. The need for this program arises when the client is thinking in his conscious or subconsciously about a behavioral change, and according to the level of his motivation and resources, he can be staged, and effective actions to support his needs can be addressed. The socio ecological model, however, works in layers. It is a multi level factor considering several dimensions that interact together, enable, and shaping behavioral attitudes. The factors could be interpersonal factors, which can include the immediate peers, family, and friends, co workers surrounding the individual. Intrapersonal, which is based on self knowledge, cultural, religious beliefs, and race. Then we have community factors that involve the immediate community around the individual. We have organizational layer, which includes the workplaces, churches, school, all the other things or little organizations surrounding the individual. And finally, we have public policies which are existing at that time. Now, since the Get Fit program is a multi strategy intervention taking place at schools with the support of the Department of Education and school heads under the supervision of teachers and coaches for young students and their classmates, it makes sense to work with the SEM model because the model caters to all the layers that are already a part of this proposed intervention. And thus, SEM model is a better choice for the Get Fit program. To give an overview, the GetFit program will be a pilot program with a SMART objective. It is to decrease the physical inactivity by 2.5% in high school students aged 12 to 17 years by implementing a mandatory sports hour at 5 participating high schools in Perth over a period of 12 months. The program will be implemented in 3 stages. The process evaluation will be its most integral component and it will take place throughout. This will help in redesigning and re implementing the program when predicted and unpredicted limitations are identified. Finally, towards the end of the program, the evaluation stage will begin. We will record the short term outcomes and develop methods for achieving mid-term and long term goals. Based on previous evidence, there is an enormous potential for this program to show positive and promising short term, mid term, and long term outcomes. Now, the implementation. The implementation of this program consists of 3 stages. Stage 1 will be to approach the Department of Education to secure approval and funds. Also, this phase will invite and present the program to at least 12 high schools to register their interest, out of which 5 should be selected. The resources which are required for this part is training or program officers who will then go and present our program and designing and printing project portfolios for every high school. The budget will be allocated accordingly, keeping in mind the pay rate for the trainers and the trainees like program officers and the cost of printing and designing the portfolios. The second stage of the program will be a school and student assessment, nominating and training the coaches of the program, meeting the classroom teachers, and sending a message to the parents. The resources that will be required for this stage will be workshops. These workshops will educate the classroom teachers and the coaches about the program. The program officers will assess the existing school curriculum and policies and demonstrate how to incorporate them into the program. Workshops will also have technical assistance for student and coaches to demonstrate the use of accelerometers. Project information and consent forms will be sent to the parents. Program officers will also record baseline data for the students by recording their age and sex and survey their existing beliefs and attitudes toward physical activity. We will be also utilizing the social media of every high school to spread awareness, knowledge, and word about the program. The budget will be allocated according to the pay rate, the printing of the information pamphlets and consent forms, and organizing refreshments for the workshops. Stage 3 marks the start of the mandatory sports hour. The resources required for this stage are the provision of accelerometers and sport equipment to all the schools. Also, provision of logbooks and funding for process evaluation. Approaching the local sports club to have sports clinic at schools and fundraisers and to involve the community and parents. This stage would require the most amount of budget given that process evaluation also takes place here. The budget will be divided according to the funding for technology, pay for the project officers, technical assistance, printing of logbooks, and the sports equipment starter pack for every high school. We have given a projected timeline over here. It scripts all the activities conducted throughout the year. There will be a buffer time between each stage, which enables flexibility and prevents rigidity in the intervention, especially when barriers like delays are encountered. So we can see if the program starts in January, the first 2 months will be for the stage one. Then February and March and April would be for stage two. Stage three would begin in April and will go up till the end of October. Similarly, the process evaluation and technical support will also be from April to October. By June of the next year, we are going to start taking in the process evaluation points and redesigning and re implementing our program. And finally, the evaluation procedures will begin by the end of November next year. Now, how will we do process evaluation? A logic model has been put into place to monitor and evaluate the effectiveness of the intervention. It plays an integral part in the process evaluation as this model helps to record those features of the program performance that are significant for the liability and structural learning. It will be these factors that are checked rather than those that are easiest to gauge, and the logic model will help with that. Also, we have established a very smart objective, and together with the smart objective and the logic model, it is going to be a good evaluation. The second method that also goes in parallel with the logic model and our objective is to evaluate with the help of process evaluation questions. For example, to assess the program received, tools like weekly surveys would be used to record satisfaction among the students and the coaches. The themes of this qualitative data, when will be compared with the quantitative data of the SLRO meters, will help identify the progress and motivation among the stakeholders during this intervention. Similarly, to evaluate the extent of program delivery, logbooks will be filled by the coaches, recording the attendance and the time and the sports hour was conducted every day. These are all our evaluation questions to start off with. Now, the use of logic model and the process evaluation questions will enable the program officers to identify the barriers, challenges, and limitations during the intervention itself. This will enable redesigning and re-implementation in high schools according to the barriers. One of the predicted barrier One of the predicted barrier is the non-compliance presented by the students and coaches or resistance. Through the process evaluation, the challenge would be addressed by organizing group meetings, focusing on their reason for resistance and creating awareness and telling them the importance of their contribution towards the intervention. This is surely going to get their motivation up. Barriers like technology may arise during intervention. Therefore, a competent team of technical assistants will be available at all high schools. Budgeting could be among the barriers of the intervention, especially during stage three. A seamless budgeting breakdown and finance approval will be submitted, and a reserve will be saved for emergency use. Fundraisers like bake sales and fund runs will be encouraged in every school. This will mediate community involvement and collect funds for future interventions. Predicted potential impact. With interventions like the Get Fit program in the past, a successful increase in physical activity was recorded by a study done by Nicole Nathan in 2020. A study by Vicente also showed that such an intervention led to an improvement in cardiometabolic and cardiovascular fitness of the participants. Vasquez also stated that the intervention programs had a positive effect in preventing and decreasing obesity in children. With the provision of sports equipment, children were motivated to be involved in physical activity, which promised positive behavioral change. Therefore, this intervention has exciting potential to have a positive and long-term impacts on for future generations. Now, for the outcome evaluation, Students aged 12 to 17 will be invited to participate in the data collection after parent and guardian and student consent has been collected. A baseline data will be collected in the second stage where demographics like age and sex will be recorded. Technical assists and program officers will instruct the students to wear an actigraph accelerometer on their non dominant hand during the school day from 9 a.m. to 3 p.m. The teachers would be responsible for collecting and distributing the accelerometers every day. The accelerometer will then record quantitative data like mean activity counts per minute, mean daily minutes spent in sports hour, and sedentary time spent in the day. The coaches will also complete logbooks recording attendance of participating students, time of sports hours, and the type of sport which every student preferred. Weekly surveys assessing student and coaches' motivation and satisfaction levels will be assessed to record the qualitative data. Now, these both kinds of data collected over the period of 7 months will be then analyzed. This data will then enable short term outcome evaluation. Interviews and surveys will be done during the last month to evaluate the motivation and practices of physical activity in every high school after the intervention has ended. The data will be recorded to enable midterm goals. Now, this pilot study may form the basis of future implementation of the program across WA, and it may predict the outcome of long term goals by proxy. Interventions like Get Fit program may help our future generations immensely, and therefore they should be widely planned, designed, and implemented in the practice of public health. Thank you.